Hi, everyone. Thank you so much for joining us on this beautiful Friday. I'm Malia from the Resiliency and Wellbeing Center. I'm here to introduce our speaker for today. Dr. Kimberly Baer is a biological dentist at Natural Dentist Associates in North Bethesda, Maryland, with a comprehensive patient-centered approach to oral health that emphasizes the connection between dentistry and whole body wellness. She focuses on airway health, functional dentistry, and the critical role oral health plays and overall systematic health. Dr. Bear takes an individual approach to care, though thoughtfully considering each patient's sex, age, and the influence of hormones on oral health. She has a particular interest in sleep disordered breathing, TMJ dysfunction, and chronic clenching, and collaborates closely with medical professionals to support long-term integrative health outcomes. Her work is especially focused on advancing women's health through a personalized, evidence-based lens. In addition to her clinical expertise, Dr. Bear holds advanced degrees and certifications in toxicology, nutrition, and anesthesia, further strengthening her holistic approach to care. She is passionate about patient education and empowering individuals to better understand the connection between oral and overall health. Outside of her practice, Dr. Bear is an accomplished marathoner and a dedicated mother. She is actively involved in international volunteer work and serves as a board member for Kids International Dentistry Services, reflecting her commitment to expanding access to care and improving global oral health. On behalf of us, we'd all like to say thank you so much for being here. And Dr. Bear, please take it away.
Okay, thank you. That was quite an introduction. Okay, so an attempt to make this interesting about teeth. What if I told you that your migraines, your brain fog, your Lyme flare-ups, your autoimmune symptoms from any autoimmune issues could all be connected to your mouth, and potentially that products you're using every day in your oral cavity are actually working against you, uh, increasing inflammation, affecting your blood pressure, disrupting your sleep. And with women especially, this is a huge issue because inflammation in the mouth doesn't just stay local. It can influence hormones, energy, and how the entire body functions. This is when I ask you to take a step away and ask why. This is basically what biological dentistry does. I was a traditional dentist. I started my practice in 2000, and I had a family cosmetic practice for about the first 7 years. And in around 2007, my practice was doing well. I wasn't doing so well. I was in my early 30s. I was chronic pain patient, definitely fatigued, adrenal overload, a single mother. I had a 6-year-old son in the first grade, and he was not doing well. And he was in a classroom, in an isolated classroom in Montgomery County for kids with behavior issues and sometimes violent behavior. And bear with me because this all comes around to women's health. Um, I took him to all the traditional doctors, the pediatricians, they all said he was fine. He slept 12 hours a night. He was never sick. The ENTs were like, yeah, his tonsils and adenoids are a little big, but let's wait for puberty and they'll shrink a little bit. Consulted with orthodontists that were my friends, and they all told me bring him back when he's older and he loses baby teeth, and we'll address it then. And I just happened to sign up for a course, a master's course in orthodontics. And the very first day I went, they talked about airway. Uh, and they talked about structural issues and how that would present with adults and with children. And basically, they described my son. And the thing that she said that really stuck with me was really all you have to do is look down their throat. I'm a dentist. I look in patients' mouth all day. What are we looking for? Cavities. We're looking for cavities, but we never really get quite past that. Oh, you're not flossing enough. you're not brushing enough. It's usually the truth is, and everybody hates me when I say this, it's not always really a hygiene issue. So with my son, it was clearly something structural going on. I came home from that lecture, I looked down his throat, and sure enough, I was like, oh my God, how did I miss this? Like, he can't breathe. He can't breathe. So within 3 weeks, I got a digital CBCT machine, which no one had that early. It was a house mortgage. I got the images I needed. I found the youngest ENT I could find. My son at that point was one of the most heavily medicated 6-year-olds that was being treated at NIH just to keep him in a classroom. His behavior was erratic. No one could tell me what was really wrong. He, it presented crazy because he seemed healthy. Um, so I took him to see the ENT. They looked down at this young guy. He looked down his throat. He looked at my images and he said, I don't want to get your hopes up, but your son definitely has like severe sleep apnea and I don't think he can breathe. And I think once we get him some more oxygen, I think he's going to start feeling a lot better. So we took out his tonsils and adenoids. I expanded him immediately after, he was done healing from the surgery. And within 6 months, he was off his meds and he went from an isolated classroom to a program with gifted children. That moment was a big aha. Like, how did I miss that? Like, that was just common sense, right? Right? Like, I'm a dentist, I'm looking at people's mouth all day. How did we miss that? So that got me involved in biological dentistry and made me really stop and question, like, is this good for me? How does that make sense? Just because someone's saying this if I abandon common sense and what my gut is telling me, usually when patients come in and they think something's wrong, even if we can't see it. So fast forward that 6 years later, now I'm in my late 30s, perimenopause. And I notice I start snoring. My daughter actually tells me, you're snoring at night. And surely I'm not. So for the very first time, I go into my office and I take a CBCT on myself, not a child. And lo and behold, what do I see? I definitely, clearly have an airway issue. Not only do I have an airway issue, I've noticed I'm starting to get cavities again. This hasn't happened since I was a kid. My clenching has increased. You know, uh, my teeth are starting to shift. So I was like, what can we do for adults? And what I found was you can definitely treat this. And with women in particular, and this can happen, perimenopause, as we know, can start like early 30s, late 30s, 40s, it's all over the place. But with women in particular, this is a huge issue because as your estrogen starts to change and decrease, and especially when your testosterone starts to drop, and for me, that's what it was, the soft tissue loses some elasticity. And one of the first places you will notice it in dentistry is in the back of the throat. So women generally have smaller airways to begin with. So as this hormone shift starts to happen, our airways start to get smaller. And that's what people need to start realizing. It doesn't stay the same. And that kind of makes sense just with aging in general, because if you look at a timeline and you see people, women, perimenopause, and let's say you start getting a little less air, a little less air, a little less air, and that continues and continues. It's pretty drastic with women. With men it happens, but it's not so extreme. They tend to be, it's with women, it's as we know, it's a monthly cycle. It's pretty, it's pretty drastic. I ended up having upper airway resistance syndrome, not sleep apnea. So if I went into a sleep doctor, they would not be concerned with me. But my oxygen levels weren't bad. I was getting a little less, but there was resistance and I was starting to snore. And basically, one of the biggest issues that this really also affects is your nervous system. So I think it's something that gets underdiagnosed with women, and a lot of times this will go hand in hand with dental restorative issues, because what happens is you'll start to clench more. you've probably always been a clencher. People say, "Oh, I'm under a lot of stress." You're in your late 30s, early 40s, your careers are getting crazier, your kids' schedules are getting crazier. It's really just about stress. And as women, we use this stress excuse, when there's actually something physically going on with us. And potentially, can you imagine if you treated it and you know, got some resolve. We'll also see, um, I was plagued with a lifetime of diagnosis of depression, ADHD, and in retrospect, a lot of that had to do with I just wasn't getting a good quality of sleep. I could sleep 12 hours and I would be exhausted. But if people don't really connect the two, like ADHD, inattention, hyperactivity, difficulty focusing. A lot of women at different age points and different hormonal balances will say, I have brain fog, I can't focus anymore. And what they really need to do is get a sleep study done or, and have their dentist look down their throat and see what's going on. And then this also translates to children and especially young girls. This is a huge issue. And it affects their cycle. It affects everything. Everybody feels better if they have a better quality of sleep. I love this book. Everyone should read it. He's amazing. I think he takes all the science behind what you get and what we miss from nasal breathing. Basically, if you clench your teeth, you are not nasal breathing enough. You don't have to be a mouth breather, but I'll tell you right now, 9 out of 10 of us are not doing it. And you're really missing a lot. You really are missing your body. When you nasal breathe, your body gets into parasympathetic. There's all these things that work great for you and helps your hormones. So I highly recommend this book. Okay. And he talks about these things as well, but in tongue position and the nervous system, did you know? Okay. If you had orthodontics when you were young, not everyone, but most of you, most likely traditional orthodontics are designed to pull in and retract. So if you look in your mouth and your tongue is scalloped because it doesn't quite fit in with your teeth, or your tongue spills over your teeth, you're going to have an issue. You're going to have an issue with nasal breathing. You're going to have an issue with sleep disordered breathing. You're going to have an issue clenching. And these are all connected. And women, and especially, will find at certain points with their hormone balances that becomes an even bigger issue. All right. So I think I basically went over all this. Slide, sorry. Yeah. So as a biological dentist, another big thing, another big thing that comes into play is your bite. And there's a lot of specialists out there who will say they're bite specialists. I mean, they teach you the exact places on your teeth where they should touch. I did a lot of training with different organizations for that. What I've come to find out, sort of getting on the other side of this, is balance is key and space. You want room. So there's a place your teeth come together, and usually there's a place your jaw comes together to get balanced. And the problem is, as dentists, a lot of times we move your teeth so the two don't match. So for instance, your teeth are all crowded and you get everything made smaller and lined up and straight, and your teeth come together. When your teeth come together, they come together in a position that maybe your skeletal system isn't balanced in, doesn't put you in neutral. There's going to be psychological effects to that. And you're going to have structural issues, neck, shoulder issues. You're going to develop a forward neck posture. Um, This is huge, especially with women. You know how you see the older women and they're developing that hump and they're posed forward. This has a lot to do with the way your teeth come together. If your teeth come together in a position that retrudes your jaw, you don't have enough space for your tongue, you will hold your head forward to get air past it. You will have to. Going like this is not comfortable because you can't get a lot of air past your tongue. So you'll do this, just like this. And it's like you're holding a bowling ball on a stick. It sits on this post and you're holding it at an angle. So what you'll find is your traps and your pecs are always going to be tight. Patients will come in and say, I hold all my stress right here, just when I get stressed out, right there, right there. Yes, I'm looking at them and their neck is forward and I know they're clenchers and, and usually they've had some orthodontic work, sometimes not, but these things are just going to get worse as we age, and especially once we hit menopause. I love this. I don't even know who said it. But I think there's been different times when I'm learning about all these things and it becomes overwhelming. And I think we should just remember our bodies are designed to figure this out. We usually just get in the way. So, as a biological dentist, this is where my business partner, Dr. Tipograph, and I would laugh that we should be hired. There is no vitamin D association that could hire us that we sell it, but we definitely are big believers in it. Most women are chronically low. I was chronically low for many, many years. Vitamin D level is in this country is kind of a joke. Uh, if you're seeing a good functional medicine doctor or a naturopathic physician, or you're way ahead of the game. But I can tell you, for the most part, everyone else who's not supplementing is deficient. You're not going to be able to get enough from the sun. And as a woman, this is huge. And the problem doesn't start with perimenopause or menopause. The problem starts with our young girls when their bones are starting off. That is the most important time to get good quality bone growth. We want our children to not have hair, osteopenia or osteoporosis. Then we need to supplement them with vitamin D and K. Uh, our kids need it as well. They need the same levels that we need. The Academy of Pediatric, I looked it up, medicine, they do not recommend testing for vitamin D unless the child shows signs of rickets. That is ridiculous. Uh, there you go. The biggest thing in decay prevention, I have found patients will say, what about this toothpaste? What about this mouth rinse? The biggest thing that you can do is take vitamin D and K regularly. Of course, always check this with your doctor. There are, certain conditions where they definitely need to be monitored. But the sweet spot we want is 70. With D and K, though, regularly, around 70. It can be a little less, it can be a little more. That's really where we see the difference in your oral cavity. For patients losing bone, periodontal disease, all this stuff increases. I wonder why with perimenopause and menopause. It's because, we're no longer, we need to go that extra mile. Our hormones are changing, and unless you're working with a really good, functional medicine or naturopathic physician to stay on top of this stuff. And even if you are, this is one area dentally that is super important. Teenage girls. I have a 17-year-old daughter. This is a passion of mine. Okay. She didn't, I supplemented her when she was young, and then she went through a few phases where she was not going to do anything I told her to do. She's she's back listening to me again. And I'll tell you what, when she does this, her mood is so much better. It's so much easier to be around her. I think the big selling point is, it's great for their hair and skin. But I definitely, I see young women, young little girls, young big girls come in my office. I see decay issues, and my heart breaks because, you know, sure, good hygiene is very important, but most oftentimes that is not the problem. They can't, doesn't matter how much they brush, they're still going to get cavities. I see it all the time. There you go. So, yeah, in their 20s. The average is they have in their 20s, which is right above rickets, but no one's testing. So, we like 60 to 80. That's optimal for function and inflammation control. And I don't, you know, I always, discuss, I definitely recommend getting your levels checked and talking to your providers, but I have yet to meet a patient that didn't have to supplement to get their levels to be, in a range that was healthy for them. All right. So as we see these hormone changes, and as I went through it with perimenopause and menopause, we see also patients come in all the time, women especially, with reflux. This is a big problem, and definitely functional medicine and naturopath, all the alternative, they are amazing at dealing with this. But I can tell you right now, if you're a practitioner and you're watching this, those patients are usually tongue-tied. It's a problem. Tongue-tied, they're, you know, if, for instance, you should be able to open your mouth as wide as you can and rest your tongue on the roof of your mouth. Um, if you can't do that and it's sort of stuck in your airway, especially if you don't have good mobility there, it's an issue. And this is where working with like myofunctional therapists can be amazing. I mean, I've had patients, go through this and address the tongue issue. And I've seen all kinds of problems, but we'll see it in your mouth. A lot of times they won't even know that they have it. It's usually some sort of, oh, sorry, some sort of acid erosion. There you go, issue. Um, Also, the biggest number one issue as far as like decay and clenching with perimenopause and menopause is going to be the effects of the decreasing estrogen and their oral cavity getting a little dry. Everything gets drier. Throw in there a little acid erosion, clenching, increased clenching, got a little airway issue, and it's basically like the perfect storm. There you go. All the great things we have to look forward to. But really, you know, optimizing your vitamin D levels, doing a sleep study. These are simple things, figuring out, am I getting enough air at night? Am I getting the right kind of sleep at night? A lot of my patients, they don't have sleep apnea, but that's not really, it's really the disruptive sleep. So now we have ADH meds, which everyone's on and everyone's kids are on. And we're seeing a lot of decay issues with this, especially with young girls. And then I see it with young girls, ADH meds, uh, they go off to college and, they have the hormone cycling issue and then the ADHD on top of it. They're most likely vitamin D deficient, and it's the perfect storm for decay. They come in from college or they come in for a break on a college. How many college students we see, and we're just like, there's decay everywhere. And really, I mean, of course, you have to treat some of those areas of decay, but you also want to try to focus on making the changes that will stop the process from happening. GLP-1 medications, they're everywhere, pros and cons. But it's really important to tell your healthcare provider if you're on it because my main issue with this is right now is really just it's going to decrease the amount of saliva in your mouth. It's going to increase your dry mouth. Women oftentimes have dry mouth and they don't even notice. I don't know if it's because I feel like we are so programmed to push forward and focus on everyone else that we're taking care of, but if your mouth is even a little dry, and oftentimes you don't even notice it, and if you're taking this med, or you're taking an ADHD med, it is. If you're in perimenopause or especially if you're in menopause, it's definitely, your definitely mouth is drier than it used to be. And that's where you really want to work with your dental provider and figure out a plan and be, really work with like prevention. All right, oral microbiome testing. This is great. There's a few different tests out there. Most biological dental offices do this. It's so interesting. My patients, I love it when my patients do it. It's great for looking at the whys. For instance, if you're losing bone in your mouth, if you have periodontal disease, a lot of patients have family members or they're dealing with some sort of mental decline or dementia issues. We know that, certain bacteria cross the blood-brain barrier and are involved in these processes. And, these are great tests, and I think they're getting better and better to really connect the dots. Okay, hidden infections. I love this one. Um, with the imaging that I've been talking about, the CBCT, that's basically, it's like a piano, it's 3D, it's changed the way we practice. We can see things we could never see before. And one of the things that we're finding that we are finding hidden infections, infections that we didn't know were there. And this is involved with brain health, with just systemic health. No one wants these infections in your body, your surgeons, your doctors. How many times, I've had patients come in and they've been dealing with infections. Like, for instance, we get a lot of referrals from infectious disease doctors, like people who are treating their patients for Lyme, and patients will go through the treatment, they'll get better, and then it will come back. They'll get better, and then it will come back. So you get these areas in your mouth, whether it's around an extraction site that was done years ago, or it could be, around a root canal that's reinfected that you just, you don't feel anything, or it can just be a tooth that's infected that you didn't know. And these sites have very poor blood supply. So what happens is they're areas where viruses can hang out. So for instance, you're taking all these antibiotics, you're going through this treatment, and it's knocking everything down. They can kind of hide out in these little hidden infection sites and wait for the treatments to stop, and then they come back. So it's a burden on your immune system. Like I said, these hidden infections, they've been linked to brain fog, fatigue, mood changes, neuroinflammation. Uh, Everyone should be checked out for them. So this 3D imaging, patients often come in and they're very concerned about radiation. Uh, the amount of radiation, it really varies with different machines. We use a green machine, which is the lowest in radiation. It's equivalent to basically walking through the airport. Uh, but it allows us to evaluate your airway, why you're clenching, if you're getting enough air when you lay down, identifies hidden infections, sources of inflammation, detects growth pattern issues. We take this, if possible, on every new patient, no matter what the age, especially with your children. The payoff is huge. Okay. Now, these are hot topics, probably the least interesting for me because I've been talking about them for so long, but I feel like I should touch on it because there are big differences between a biological dental office and a traditional dental office. And actually, and for women especially. Fluoride, I'm going to sum it up. We get too much of it. Uh, Once again, it's a common sense thing. It's a hormone disruptor. We used to use fluoride to slow down the thyroid. Therefore, last thing you want to do is be throwing more, you get more than you need. You really don't need any. You get more than you should have in the water. So to be throwing more in your body with, toothpaste and rinses doesn't make any sense. It's corrosive. I find it interesting. We know it's corrosive, and yet you'll see kids with brackets and wires on, and they'll be giving them high fluoride treatments for decay. When you take those brackets and wires off their teeth, um, you'll see these white spots everywhere, and it's actually fluorosis. It's where the metal actually eats away at the calcium layer of the teeth, but then the fluoride actually, if you especially increasing the fluoride, gives you these white spots, and it really it can harden your enamel, but what it does is the quality of your enamel is very poor at that point. This is a meridian chart, and it really goes back to the whole basics of where biological dentistry came from, how we basically are in line with the idea that your teeth are connected to the entire body, and the meridians are, like acupuncture points in the body that show exact connections from very specific teeth to specific organs, like basically like a line of energy from these sources. So when there's a disruption, like an infection, that causes a blockage, not only in the tooth, not only does it affect the tooth, but the belief is that it affects the organ as well. This slide is sad and makes me laugh at the same time. The 2026 FDA amalgam filling stance for the FDA. So my husband found this. Basically, they're saying there are some high-risk populations that should not have these amalgam/mercury fillings in them. That would be children, women who are pregnant or planning on being pregnant, nursing mothers, people with any kind of neurological issues, and then people who are sensitive to mercury. So, as far as I know, mercury is one of the most toxic substances on the planet. No one should have any amount of it. Everybody is sensitive to it, is harm and damage. So, I don't really know who falls into the not at risk population, but that's almost comical. And then the second thing, it says why, and then it says if your fillings are in good condition, the FDA recommends you should not have them removed. So, amalgam fillings, mercury fillings are 55% mercury. And if you read the box that the filling material comes in that they give dentists, it says on there that this material should be removed from the patient's mouth after 10 years. And the reason being, around the 10-year mark, it can vary, the mercury starts to vapor off of these fillings and create spaces in between the filling and the tooth in which the patient can get cavities. That's why people have their large, dentists don't want to remove your large fillings. It's because they know underneath of them, there's probably a lot of decay or the tooth is going to break. So what happens is patients don't get them removed and then the tooth breaks or it gets infected and they need a root canal or they need an extraction. This process never made any sense to me at all. Uh, they should be removed, in a manner that doesn't expose you to more mercury. But if you keep them, you're basically just slowly consuming this mercury every time you eat. So it makes no sense. Root canals. Root canals are tricky, very controversial. What we're seeing now, because we have this imaging, is that a lot of root canals that we thought were okay are not okay. So if you have root canals or considering getting a root canal, you definitely want to have good monitoring of it with a CBCT machine. And even if everything feels okay, you want to continue to monitor that because these are sites that you can have a hidden infection and you'll never feel a thing. And it's really can be a drag on the immune system. Cavity remineralization. This is something we're really big into and is becoming, popular, I think, across the board, which is great. You know, there's a lot of great products out there. There's some products with peptides in them that I really like. But honestly, it all comes down to what are your vitamin D levels? What are your vitamin D levels? Like, are you, where's your calcium? You know, what what are you using in your mouth? Like, as far as like, if I could choose any materials for you to use in your mouth, I would say coconut oil and salt water. Um, there's lots of ways we're doing some really great things with remineralization, but ultimately you can remineralize as much as you want. But if you don't figure out what's going on and why this is happening and correct that, it's just going to be a cycle that's not going to end. You're not going to be able to keep up. So people always want to talk about what products, there's a lot of products out there now. My goodness. When I first started doing this, getting into this stuff in the early 2000s, it was Tom's of Maine, and that was really it. Maybe there's really just very little. So there are many really good products. I try new products all the time. There's a lot of good ones out there. So the most important thing I tell my patients is there's certain things you want in your products and certain things you don't want in your products. And this is a very short list of some of the things. We don't want the SLS in it, but we want the hydroxyapatite right now. That looks like the best option. And more importantly, these are the things you don't want in your dental products. Whitening, there's a lot of charcoal things out there. The whitening products, the problem with that is they're too harsh. They remove enamel. So it's almost like you have a pan that you cook with and you use like a super abrasive pad to clean it, and it gets everything off really good, but it scratches the inside of your pan up terribly. So then you go to cook something on that, use that pan again, and everything sticks to it. And then you got to get the Brillo pad out and scrub it off again. That's what whitening products, that's what like those really abrasive whitening products do. They basically scratch off everything and they put a lot of scratches in your teeth. And so you're going to be more prone to picking up stains. What the goal is, it's close to a dental cleaning, or let's say you get it, everything in your teeth, you get all the stain off your teeth. Really want to think about moisturizing. It's really about moisturizing. You want to, if you have a decreased saliva, if you're going through perimenopause or menopause and your mouth is a little drier, you're going to pick up more stains. You're going to pick up more stains, and it's going to be harder to get those stains off. So what you want to do is you need to supplement with things like extra virgin organic coconut oil. You want products that basically moisturize your mouth because that's your biggest defense in stopping stain and even whitening. You want to do things that basically plug up the pores of your teeth with calcium. There's a lot of great products out there. And then you want to moisturize. So we have at Natural Dental Associates, we have a lot of daily core supplements. We're really into the Swiss dental solutions methodology and protocols. This is just some, a short list, but I do not think I wish you could get everything from food. I think that you can get a lot of things from food, and that's the ideal way to do it. But uh, to really idealize in our environment today, you need to take supplements. Um, some of us more and some of us less. So I do recommend you really want to dig into this, looking at the Swiss Dental Solutions website. Sorry, I don't have a slide for that. They've got great information on their website about what supplements they recommend and how that affects the oral cavity and systemic, benefits. And then they also supply all the research for what they recommend. So I hope today you could take away from this that your oral health really, reflects what's going on, generally speaking. And the great thing is that you can do really simple things that's gonna, support your body and make changes. I mean, there's so many things that are evident. Like a patient comes in and she sits in the chair, and how old is she, and if she's older, if she's perimenopause or menopause, ask if she's doing like bioidentical hormones, what she's doing. That lets me check off a few concerns, and if she's not, then I got to look at things a little differently. Um, but your body's needs change, especially as a woman, and I feel like it can happen pretty fast, oftentimes. And as it changes, so should your oral health needs. It's not 6 month clean, it's not the same old, same old. If you really don't want to spend your money on, never ending dental cycle, you really got to start looking at, why do I have the dental work I have? And how can I stop this? And so when we sit in our chair and we look and we see multiple crowns on posterior teeth, root canals, clenching, why? Why is that happening? Sometimes, you're not in a position to specifically address it and fix it. But if you understand it, there's a lot of things you can do to protect yourself. So, action list. Um, I would recommend everybody review their blood work, with either a functional medicine practitioner or a naturopathic physician, and then share that with your dentist because, you know, there's going to be some things that, we want to, sometimes we just don't even know what's going on. Uh, Definitely work with a good functional practitioner. I think I can't say how important that has been for me. And you want to use microbiome friendly oral products. Why, we spend money on things that are actually hurting us. I mean, Listerine, throw that in the toilet. Like, I find it fascinating that someone marketed that it kills 99.9% of the bacteria in your mouth, that was a good marketing angle and everyone bought into it. Like, yeah, yeah, that's good. You know what else does that? Bleach. Like, you're not going to rinse your mouth out with bleach. Sounds like a terrible idea. My father was addicted to it. Like, and what those things usually do is they dry your mouth out and that bad breath or whatever you're using it for, you're actually gets worse. It'll come back quicker. Like try a moisturizing rinse or no rinse at all. We don't want our patients using mouthwash before bed, especially before bed. No mouthwash. It decreases nitric oxide. There's the whole plethora. So really think about the products you're using and whether or not they're helping or hurting. Everyone should get their airway evaluated. Everybody, especially if you're clenching or snoring or mouth breathing, especially children. And I would consider, deeper testing potentially. If you have the MTHFR gene, you know, that's a consideration. You're going to absorb potentially, depending on what form, certain minerals and supplements less. I have it. I have to keep my D levels a little differently and my B levels and really makes a difference. So everything can look fine on your lab work, but if you have that gene, you might need to change things up a bit. And I think I'm a big believer in the CBCT at least every 5 years. I mean, case to case, but everyone should at least have it done once and see what's going on structurally. So I hope I just barely touched on a few topics today and hopefully I get everyone would get out of this is to be inspired and start questioning sort of and not just going with the norm because especially women, young women, and especially at different points in your life, your needs are going to change. They're not going to be the same. And if things aren't changing, then you're going to have more issues and less things are going to be able to be addressed with prevention. So I hope that everybody enjoyed this. All right. Any questions?
We have some questions in the chat. So, what do you think of oil pulling?
I think it's great. I love it.
For those in the audience that don't know what that is, could you explain it a little bit?
Sure. That is basically you could do different types of oil, but basically we like extra virgin organic coconut oil. You can get it from any grocery store has it. There's no special brand. And it's like a Crisco and you get it and you take a spoonful of it and you basically swish it around in your mouth. Like after you brush your teeth, you're going to swish it. They'll say to really get in there, you got to do it for 20 minutes. I've never been able to do it that long. I think even if you did it for a few minutes, you're going to see benefits. 'Cause as soon as you put it into your mouth, it turns to liquid. You swish it, swish it, swish it, and then you're going to spit it out. Don't spit it down your sink. It'll clog it up. You want to spit it in the trash can. But it basically your microbiome loves it. It moisturizes everything. It's great for protecting your teeth against decay, staining, helps whiten your teeth. I mean, there's no downside.
Okay, so we have another question. Should you increase dental cleaning with age?
Depends on depends what's going on with you. That really depends. I don't think that, just depends what you have going on.
Question. My dentist has me using Floridex toothpaste and CLOSYS mouth rinse with fluoride because I have receding gums. I'm confused why you're not recommending fluoride.
Hmm. Well, you get too much of it. Okay. And most people have, fluorosis, which is basically high levels of fluoride actually weaken your teeth and make them more decay prone. So fluoride is also very corrosive. So I have to ask you, do you have any metal in your mouth? Do you have any metal fillings or crowns that have metal in them? because it's very corrosive for that material. Fluoride is a neurotoxin. It's a carcinogen. It accumulates in your organs. I do not think that you should be using fluoride. There's a, if you Google it, there's a lot of websites out there. I think we get too much of it. I think if you have receding gums, you're most likely, why do you have receding gums? Number one. Number two, I'd be using something like coconut oil, more moisturizing, or something like the Risewell varnish is great for that. Um, I don't know why, fluoride doesn't even work on root surfaces. So I don't understand why the recession thing that doesn't even make sense to me. Sorry.
What about Tom's of Maine mouthwash for bad breath?
So uh I'm not a big fan of mouthwash. If you're going to use it, don't use it before bed. It basically kills the bacteria that your body uses to make nitric oxide, which helps you relax and lowers your blood pressure. There's been a lot of studies on that. We know that it's true. So if you're going to use something like that, I do use mouthwash occasionally. Like I'll use it like in between meals if I can't brush my teeth or if I'm going for a run, I don't have time to brush my teeth just to sort of clean everything out. That potentially could be fine, but I definitely would not use it before bed.
Okay, and then we had a question from the same person concerning gene. I'm not really sure what that is about. Um, but Karen, can you raise your hand? Do you know how to do that?
Yes, you mentioned something about how you have a certain gene, and that affects things differently. And I didn't catch what that gene was and how it affects things differently.
So if people have the MTHFR gene, there's different variations, but that affects how you metabolize things and use certain minerals and supplements. So, like your vitamin D, for instance, you could have on your blood work, your vitamin D level could look fine, but that doesn't mean that's what your body's not actually using it as well. And same thing with some B vitamins. So, yeah, so a lot of times, you know, uh, a lot of our patients will do advanced genetic testing, and that kind of changes sort of, what supplements they should be taking because it can change how your body uses them.
Hmm. Okay, so one of your patients, Cheryl Littleton, said some lovely things about you in the chat. So if you have time, please go and read them.
It's so great.
Uh, okay, Debbie, I would advise you to use earbuds or headphones because Dr. Beer comes through very clear. Okay, Lee, I don't know what to what to tell you. Can everybody hear me?
Yeah,
Am I
I can hear you.
okay? Uh, Question: I've never heard of extra virgin oil, olive oil for oil pulling. Can you use liquid?
So, not olive oil. I'm sorry, coconut oil. It's coconut
Okay,
oil.
okay. Uh, Another question. My dental hygienist recommended Stella Life antimicrobial rinse. It has xylitol and propolis. Is that useful?
Yeah, that stuff's great. That's a great product.
Okay. Lee is saying that mouthwash is an independent risk factor for cardiovascular disease.
So, uh, there's been studies on it increasing blood pressure.
Oh, okay.
Yes, because it decreases your nitric oxide production, which increases your blood pressure, which and nitric oxide decreases your blood pressure. So I think it was in Puerto Rico, there was a really good study done where they, took people who had were on high blood pressure medication and took their mouthwash away after it wasn't that long a period. I wasn't know if it was a week or a month, but everyone had a decrease in blood pressure.
Mm. Okay, y'all. I think I fixed my volume problem. I apologize for that. It's been an interesting afternoon with technology. So, what I am going to do, since our group is a group that doesn't look like there's anybody interested in doing any bombing, I am going to give everybody a chance to, once I figure out where I'm going, hello, uh, give people a chance to unmute themselves so you can ask any more questions you would like to Dr. Baer. All right, so everybody should be able to unmute themselves. If you have a question, please go ahead and unmute yourself and ask it.
Yes, I'm wondering, I'm the person that my dentist has me doing Floridex toothpaste and the closest with Floridex rinse. What toothpaste is there a toothpaste that you recommend? I have receding gums from overbrushing. I brushed too hard as a child.
Yeah, that's a problem. Yeah, so there's a few. The one we really like is Risewell. It's a brand you can get online. It has, and if they're really worried, if you're prone to getting that root decay, which is which I think he's trying to prevent with you because of the recession. Those roots are always soft on people. Um, that works really well, but I would really look at, you know, um, you know, like moisturizing your mouth. Like I think you'd be a great candidate for like that coconut oil and make sure that you're not clenching and just, nothing harsh.
And would I do the coconut oil rinse every night, like before bed?
Yeah, if you could, that would be fantastic. You should experiment with it. Do it for like, say, 2 weeks. I think you're gonna find the same thing I found. I went through this whole thing where I had to go use natural products. It definitely is different. Once you get a little distance on it after a few weeks, if you go back and you try to use what you were using before, you will realize your mouth is telling you it does not like it. I can't even use the little sample Colgate things anymore. I used to use them just because we used to get them if I traveled, and I can't. You'll notice the next morning your breath is better, your teeth are less sensitive, you'll pick up less stain. It really works.
I'm nervous to stop the fluoride because I've been going to this dentist for years and years, and that's what she's recommending. This is the first time I've heard not to use fluoride.
Yeah,
So,
I
yeah.
I hear what you're saying. I don't know what to tell you. I can tell you this won't be the last time you hear it because I think in the next 10 years things are going to change a lot. So, I mean, I understand what you're saying. I do. I used to be a dentist that used the same things. And I think that there are things out there that work better that are actually good for you, which is a good thing. I don't know. I would experiment with it.
Maybe I'll do Floridex in the morning and I'll buy this Risewell toothpaste at night and do you said organic coconut oil rinse
You could.
at night.
You could start with that. But I think, yeah, I mean, I get it. Believe me, I get it. I didn't even, when I started to learn about this stuff, I wish I didn't know about it. because it is a hard pill to swallow once you realize that you might have been recommending things that weren't good. And I understand that people don't want to hear that. But if you do a lot of your own research, now, if you only got fluoride in the dental office, it would be a different conversation. The problem is we get way too much of it. And now, it used to be that's all we had for certain things in dentistry, but now we have things that are non-toxic and better for you and, help support your microbiome. Fluoride, do you have any metal in your mouth?
Yes, I have fillings from cavities.
Yeah, you always just go on Google and Google what the fluoride does to this. So,
So
yeah,
it won't increase the amount of cavities if you stop using the fluoride toothpaste and rinse? It
no,
shouldn't, in theory, it shouldn't increase it?
no, no.
Okay, so I have some more questions. Um, would coconut oil be something you would recommend to someone with braces?
Oh yeah, yeah. A water pick and some coconut oil. Definitely no fluoride.
And I have a question about Invisalign products. Do you talk about microplastics in Invisalign products?
So yeah, microplastics. It's a hot topic. There are some, plastics, there's a range. Some of them, come apart and they definitely, you know, off gas and lead off more. I mean, the goal should be if you're doing, Invisalign, there's definitely cheaper products with cheaper plastics that are worse for you. Um, and the goal should be if you need to do something like that, you kind of try to get through it as quickly as you can, but you shouldn't be eating or drinking with them in your mouth.
Do people do that?
Probably, yeah, I'm sure they do. I mean, they
Oh,
shouldn't, they're told
geez.
not to.
Okay, I have a question about asking for a toothpaste recommendation.
Mhm.
Would you care to give one or not?
Oh, so yeah, so I like the Risewell is great. I like the Risewell. We also use a little bit of I like the Zebra brand, basically coconut oil. Um, but yeah, Risewell's great, especially if you're worried about decay.
And another question, do you recommend custom-made mouth guards if you grind your teeth? Are you concerned about microplastics in them?
Uh, I do recommend them, not to everybody. Yes, and some materials are not equal, but the better ones, they have to be exposed to higher temperatures, and you're not eating or drinking with it in your mouth, so you should be fine. You know, uh, there's a lot of variation in guards. There's a lot of materials, and there's a lot of designs. I would say if you're clenching your teeth and you need a guard, you need to find out why you're clenching your teeth. It's usually nasal breathing, tongue position, things like that. And then make sure that the material that they're using is, good quality.
Okay.
May I ask another question? I'm wondering about I have sleep apnea and I breathe through my mouth at night. Any suggestions to get someone to breathe through their nose?
Yeah, so that's going to be the number one reason you're going to get cavities. It's going to be the mouth breathing. First of all, I would definitely go buy that book by James Nestor, Breathe. It's a bestseller because that book's about you and me, and you should read that book. It's a game changer. You should definitely get a CBCT and see why you're doing that. It's most likely could be tongue position, and you're not nasal breathing. I would recommend, like with our patients, we'll have you do a consult with our myofunctional therapist. And basically, there's a lot of things that you can do on your own to correct that, and it can be life-changing. Um, I don't know, you know, how bad that, but I do know we also work with some really good ENTs, and what we found is, especially with the female patients with the smaller airways, if we can increase your nasal breathing, oftentimes they can eliminate the sleep apnea. It's all about breathing through your nose. And if you're not breathing through your nose, it's just a plethora of problems. So you got to figure out structurally why. And you want to start with getting like a CBCT x-ray and having someone sit down and explain to you why this is happening. Then you can figure out exactly what you need to do or what, at least what your options are.
Can a regular
Okay.
dentist do a CBCT X-ray, or do I
Depends.
need to see a ENT?
No, you could come, like if you came into our office, we do them. Some offices do them. You just want to make sure that they're basically airway focused because it's about, if you go to some dental specialists, they'll just do one of like a tooth or an area. You want someone that actually looks at the airway.
Okay, friends, I think we'd all like to thank Dr. Baer for coming and giving this amazing presentation. If you would like to know more about biological dentistry, I dropped her bio and her practice website in the chat. All of this information will also be included in the post-event email.
Thank
So
you.
thank you. Everyone have a wonderful afternoon and happy trails.